happy evening, a very good evening. A quick note whether I'm audible and visible, everyone. Just let me quickly check the live chat. Give me a minute. Hi, happy evening, everyone. A very happy Sunday evening. I hope and I believe all of you are doing well. Yes? All right, great. So here we are starting a new series as well, where we will be discussing top 10 mnemonics from the various subjects. And yeah, so it's going to be revision for the users, for the students who have been using the Medsynapse app. You will learn some extra mnemonics as well. And for the students, for everyone, basically this is going to be a very high yield revision of the must know topics. So we are going to see like the most frequently asked topics in various subjects with the help of the mnemonics and the MCQs, right? Yes, definitely. That is what we are going to do here. So towards the end, I'll be catering to your queries as well. Till then, let's quickly discuss the top 10 mnemonics here, right? And this is your first question here. So true about the muscle shown. What is true about the muscle shown here? Yeah, this is very, very important for FMGE also. So look at the muscle which is shown here. What is its action and what is its nerve supply? Is it? Yeah, very good. Absolutely right. Naveen, Rashi, Arif, Shivam, absolutely right. The correct answer here is D. The muscle shown here is a tensor and it is supplied by external laryngeal nerve. How do we identify this muscle here is, so this muscle basically is connecting the thyroid and the cricoid. Okay, the cricoid and the thyroid. So this is how you identify that this is the cricothyroid muscle. Okay, what muscle is this? Is cricothyroid. And an easy way to remember the action of the cricothyroid muscle is, remember cricothyroid CT is a CT. That means it is a cord tensor. Okay, that means it is a cord tensor. So remember that the action of cricothyroid is a cord tensor. It is not the abductor. And this is the only muscle which is supplied by external laryngeal nerve. So remember it as ECT. Okay, so external laryngeal nerve supplies which laryngeal muscle is the cricothyroid. Rest all are supplied by recurrent laryngeal nerve. External laryngeal nerve in turn is a branch of superior laryngeal nerve. Okay, so superior laryngeal nerve is a mixed nerve. It gives the motor component, that is the external, and the sensory component, that is the internal laryngeal nerve. Okay, yes, absolutely right. So this is the muscle. The cricothyroid is the muscle which is present on the external surface of the larynx. You can see it from outside. You are not seeing from here inside. You are seeing it from outside. So lying externally, connecting the cricoid and the thyroid, it is supplied by the external laryngeal nerve. Okay, it is supplied by external laryngeal nerve and it is a tensor. Is this clear with everyone? Yeah, so we have discussed. So all the students who have the Medsynapse app subscription, you should be watching this larynx anatomy wala from the main videos folder. In the app, you should be watching this larynx anatomy that has been discussed in the ENT main videos as well. Okay, very, very important. So that was the first trick that we have seen. This is the first mnemonic. Going to the next one, again a topic, very, very important topic for all exam, the types of joints. Let us see how many of the tricks do you remember here. All of the following are ball and socket type of joint except. So you know the importance of the types of joints even for the INICET exam. In the recent INICET exam, there was the question on the types of joints in INICET as well. So which of the following is not a ball and socket type? Absolutely right. Very good. So that is incardomalleolar joint. Very good, Shri. So you remember the mnemonic. So the mnemonic for the ball and socket type of joint is this is ball and socket. So remember that the mnemonic for ball and socket type of joint is this. This is ball and socket. What do we mean by this? It is TCN, that is talocalcaneonavicular joint, hip joint, shoulder joint, we all know. And remember the IS is to remember that it is the incardostapedial joint, which is the ball and socket joint. What happened to this? Yeah. It is the incardostapedial joint, which is the ball and socket, not the incardomalleolar. So the joint between the malleus and the incus, that is malleus and the incus, remember MI. If anybody gets MI, it is definitely a sad thing to happen, a sad event to happen. So remember that MI is sad. That means the joint between malleus and incus is sad. That means it is a saddle type of joint. Okay, it is a saddle joint. Is this clear with everyone? So remember MI is sad. So MI is saddle and this is ball and socket. Now the types of joints is a video which is a free video again on the Medsynapse app by Dr. Nikita. So that is it's available in the free videos. So all of you should or rather must definitely be watching that from the app. Okay. Very, very important. The types of joints is absolutely important, and unless you learn it with the mnemonics or tricks, it's very difficult. It's a very volatile topic. So otherwise you will tend to forget it. So please learn all the tricks from that video for all the types of joints. Okay. Going to the next question. All of the following drain into the middle meatus except which of the following? Thank you so much, Shivam. All of the following drain into the middle meatus except. Very good. So she knows all the mnemonics on the tip of the tongue. Amazing. That is the posterior ethmoid. Absolutely right. Where does the posterior ethmoid, the PE, drains into? Remember, the PE drains into the PE wala meatus, that is the superior meatus. Okay. So posterior ethmoid, that is PE, drains into the PE meatus, that is the superior meatus. Okay, that is the superior meatus. What drains into the middle meatus? Remember, the mnemonic is my frame goes in middle. Okay, so imagine like taking a photograph and you say that my frame goes in the middle. So my frame is middle. So my M for maxillary sinus, FR is frontal sinus, AME is anterior middle ethmoid. Okay, now it is divided into anterior and posterior ethmoid. Previously it was anterior, middle and posterior. So remember that except the posterior ethmoid, the anterior middle ethmoid is going into the middle meatus. Okay, that is the middle meatus. And even your sphenoid sinus does not drain into the middle meatus. It goes into the sphenoethmoidal recess. Okay, it goes into the sphenoethmoidal recess. Okay. Yeah. Thank you so much, Surya, for those kind words. Right, the mnemonics actually help, and I think it proves that. Okay. Going to the next question, coming to embryology. Which of the following develops from mesoderm? Which of the following develops from mesoderm? Liver, melanocytes, dura mater, or adrenal medulla? Yes, what's the correct answer there? Very good. Absolutely right. This is dura mater. Okay, this is dura mater. Let us have a look at the various options here. Liver. What germ layer liver develops from? Why many of you are answering adrenal medulla? It does not develop from mesoderm. Okay, let's answer. Let's look at the various options. Liver. Remember that everything related to the GIT and GIT के साथ हम कौन सा system पढ़ते हैं medicine surgery में? The hepatobiliary pancreas system. So basically the GIT or the respiratory tract, the trachea and the esophagus, you know that how they are going together because they are developing from the same germ layer, that is the endoderm. Okay, that is the endoderm. Melanocytes develop from neural crest cells. You have the mnemonic MPSC goal, right? Cracking the goal of MPSC is like a crest. So the mnemonic for crest is MPSC goal. What does M stand here? M is the melanocytes. Okay, M is the melanocytes. A stands for adrenal medulla and L stands for leptomeninges. Which are the leptomeninges? Remember, lapto is A and P. That is the arachnoid plus the pia mater. Those are the leptomeninges. So leptomeninges develop from the crest, but dura mater is developing from mesoderm. You also remember it with the mnemonic wearing the MD ka cap. If you get MD, if you get into MD, it is like another feather in your cap. So the mnemonic is MD cap. That means from the mesoderm, you get the dura mater. From the crest, you get the arachnoid and the pia mater. Okay, that is another mnemonic there. So remember that it is MD cap. That means mesoderm से dura आता है और crest से आता है arachnoid और pia mater. Okay. For the adrenal gland, the mnemonic is adrenal has a cortex and the medulla. Adrenal cortex, adrenal medulla. C is for M, M is for C. So adrenal cortex develops from the mesoderm, adrenal medulla develops from the crest. Okay. So remember that the medulla is developing from the crest. It is the cortex which is developing from the mesoderm. Is this clear with everyone? Yes. Okay. So remember that liver is endoderm, melanocytes is neural crest cell, dura mater, MD cap, mesoderm is dura mater, medulla is from the crest. Okay. Which one do you want me to repeat, HK? For the adrenal, is it? For the adrenal cortex, C is for M. The cortex develops from mesoderm and medulla develops from crest. The MD cap is M for mesoderm से develop होता है dura mater, crest से develop होता है arachnoid और pia mater. So basically MD cap is your mnemonic for the meninges are developing from which germ layers. Mesoderm dura mater, crest is arachnoid and pia mater. So basically these are the leptomeninges. Okay, the leptomeninges. Okay. All right. Going to the next one. I've already written the mnemonic here for you guys. Tell me what is the answer to this one. All are branches of internal iliac artery except. That's the very reason, Naveen, that we are having the session here, Naveen and Shri, so that you can revise the mnemonics, and if you're able to recall, that is going to give you an extra confidence. All are branches of internal iliac artery except. Surya, don't make that mistake, right? So if you're watching the Medsynapse videos, you're not supposed to make mistakes here. It is superior rectal artery. Okay, it is superior rectal artery, is not a branch of the internal iliac artery. We'll come to these options. Let's quickly have a look at this. So basically remember the organs that you have, the pelvic organs, the bladder, the uterus, the rectum. Internal iliac artery is supplying these organs here. Okay. So the branches from the anterior division and the posterior division, right? So this is basically your internal iliac artery, anterior division and the posterior division. So what branches we get from the posterior division is What do you get from the posterior division? The iliolumbar artery. Let me have another image here. Correct. So from the posterior you are getting this iliolumbar artery, the lateral sacral artery and the superior gluteal artery. So for the posterior, remember it is pils. That is from the posterior division of internal iliac we get ILS, iliolumbar, lateral sacral and the superior gluteal, S for superior gluteal. Remember that posterior division is the superior gluteal artery, not the inferior gluteal. Superior has P in it, so it is posterior division. Your inferior gluteal artery, this is your inferior gluteal artery coming from the anterior division. Okay, that comes from the anterior division. So remember it as posterior. पीछे क्या होता है? Lumbar vertebra, sacral vertebra and the gluteal area. Okay, so lumbar is the iliolumbar, lateral sacral and the superior gluteal. Coming to the anterior division here, the mnemonic for anterior division, remember ants and mouse. Okay, ants and mouse, we write it as mousy. What is mousy here? What is the M here? It is middle rectal artery. O for obturator artery. Okay, then you have the uterine artery which is there. Okay, and S is the superior vesical artery. I inferior vesical, internal pudendal and inferior gluteal. Okay, that is what is mousy here. So let me quickly repeat here: middle rectal, obturator, uterine artery, the superior vesicle, the inferior vesicle, the internal pudendal and the inferior gluteal. Is this clear with everyone? So the inferior vesicle artery is what is the vaginal artery in females. Okay, that is what is the vaginal artery in females. So going back to the mnemonic here, basically that we have here. Okay, so the anterior division is mousy, posterior is pils, superior has P. So it is from the posterior division. So the S here, remember the S here is the superior vesical artery, not the superior rectal artery. Remember this image here, the ant and the mouse. Okay, the ant and the mouse. Okay. So tell me that from where the superior rectal artery is coming? Superior rectal artery basically is coming from where? From where is the superior rectal coming? So if you remember the colon, this is how the colon basically is. Okay, this is how the colon is. You have ascending, you have the transverse, the descending, the sigmoid and the rectum. Okay, that is how the colon is. So if you remember the blood supply of the colon, right, the transverse colon, right 2/3, left 2/3. Up till this part, this is superior mesenteric artery. After that, it is inferior mesenteric artery. So this inferior mesenteric artery is the one basically which is going down as the superior rectal artery. Okay. So remember that the inferior mesenteric artery is the superior rectal artery. Okay. So superior rectal artery is basically your inferior mesenteric artery. So for the mesenteric artery, remember this point. Mesenteric artery, you have superior and inferior. Superior mesenteric artery gives the inferior artery, एक branch देती है जो inferior है, inferior एक branch देती है जो superior है. So superior gives inferior and inferior gives superior. So inferior gives the superior rectal artery. What is that inferior branch which is coming from the superior mesenteric artery? What is that inferior branch which is coming from the superior mesenteric artery? Yes. Where is the superior mesenteric artery located? If this is the pancreas, यहाँ पे aorta है, aorta की branch आती है यहाँ से superior mesenteric artery. So basically it is giving the inferior pancreatico-duodenal artery. Okay, it is giving the inferior pancreatico-duodenal. Absolutely right, Hope. Okay. So superior mesenteric artery related to the pancreas, inferior pancreatico-duodenal artery is what it gives. So remember that superior gives inferior and inferior gives superior. Okay. All right. So going to the next question now. The next one, what is the life-saving muscle of the vocal cords? Seems to be like a very easy question, but you are when in that stressed out situation, tense situation in the exam hall, even this becomes like, you know, the confusing question. Life saving muscle of vocal cords is? Yes, Shri, definitely I'll do that in one of the upcoming videos. Very good. That is the posterior cricoarytenoid. So remember that life-saving function is done by the pullus, right? Pullus saves us from the abductors. That is what you should remember. That is the mnemonic to be remembered, right? So if somebody gets kidnapped, somebody gets abducted, police saves from the abductors. So police safety muscle, and what is the function of the safety muscle? It is the abductor. So police is basically posterior cricoarytenoid, is the only abductor of the vocal cord. If that fails, there will be adduction and that will lead to airway obstruction. So that is why keeping the airway abducted is very, very important for life saving. Okay. Similarly, the life saving muscle of tongue is? Which is a life-saving muscle of the tongue, basically which is preventing the falling back of the tongue. It causes the tongue protrusion. Which is the life-saving muscle? The trunk protrusion wala. The tongue is protruded basically by genioglossus. Okay, that is genioglossus. Genial tubercle या mandible के यहाँ the tongue is protruded out. So preventing the fall back of the tongue. So the life-saving muscle of the tongue is genioglossus. Absolutely right. Okay, that is genioglossus, which you will see in the tongue as a fan-shaped muscle, right? You will see it like the fan-shaped muscle. It is an image-based question in one of the FMGE exams also. Okay, that is genioglossus. Clear with everyone? Right? Going to the next one. This has to be very easy. Mandibular nerve passes through which of the following? Mandibular nerve passes through which foramen? Very good. That is ovale, right? So the multiple wale structure where we might tend to get confused. Remember, one is mandibular nerve, one is maxillary nerve, okay, and the other M is the middle meningeal artery, okay, the middle meningeal artery. So out of that, how do you remember the three M's here going through the three foramens? So remember that mandibular is a man is a male, and male is ovale. Okay, male is ovale. So remember, male is man. So mandibular nerve is foramen ovale. Maxillary nerve, on the other hand, goes through? Maxillary nerve goes through? Yes. Very good. Maxillary goes through foramen rotundum. How have we remembered this in a detailed video in the app on skull foramen? Maxi. So A-chem man who's a male is ovale. Maxi, a girl wearing maxi, and she is rotating. Okay, a girl wearing maxi is rotating. Absolutely right. Right, every girl who will wear the maxi will rotate and make that boomerang. So remember, a girl wearing maxi rotating is rotundum. And middle meningeal artery. What do we have in the middle of our body? The middle of our body is the spine. So middle meningeal artery is foramen spinosum. Okay, that is foramen spinosum. This is the one, the rupture of which leads to EDH, extradural hemorrhage. Okay, so remember that spine in the middle meningeal artery. Maxi rotating, foramen rotundum. Mandibular nerve, male is a ovale. Okay, male is a ovale. Clear with everyone? So we have discussed again this foramen of skull in the short videos also, and in the main videos also. So please do watch that videos from the app. This is like a must know topic. You get image based questions also on this topic. Very, 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 very Important. And a quick update for all the viewers here on the Medsynapse app. So we have launched the 4 months plan also at a very reasonable price of just 2799, and for the subscribers, the previous subscribers whose plan has ended, the subscription has ended, you can renew it at less than half the price of this by just using the code होली. Okay, so the हमारी होली अब तक चल रही है Medsynapse app पे, so you can use the code होली and you can get this at even lesser price. Okay. All right, going to the next one. The structure lying superficial to flexor retinaculum is which of the following? Which of the following lies superficial to the flexor retinaculum? And I mean, for those who subscribe during the inaugural offer, that is during August, September, उनका extension हो जाएगा. ठीक है, we'll do it this month or next month. Don't worry. Very good. What is the answer here? Absolutely right. Lying superficial to flexor retinaculum. No, it is A. Ahmed. Remember that. See, when the median nerve is definitely not the answer to this, because median nerve flexor retinaculum यहाँ पे compress हो जाती है, carpal tunnel syndrome होता है, तो वो वहाँ पे compress हो रही है अंदर. It is within the retinaculum. Ulnar nerve is superficial to the flexor retinaculum. So let me quickly tell you the trick for this. So flexor retinaculum, structures passing superficial are ulnar nerve, ulnar artery, palmar cutaneous branch of ulnar nerve again, palmaris longus wala tendon, and the palmar cutaneous branch of median nerve. So basically what is lying superficial here? If you look at this image here, okay, flexor retinaculum, you have ulnar nerve, you have ulnar artery, palmaris longus, okay, ulnar nerve की palmar cutaneous branch, median nerve की palmar cutaneous branch और a palmaris longus. So ulnar and all the palmar, these are superficial to the flexor retinaculum. FDS, FDP are inside. Median nerve is inside. Okay, this is FPL and you have the FCRL. So flexor retinaculum के अंदर है ये सब. ठीक है, so ये अंदर है. These are the structures deep to it. These are the structures superficial to it. So if you get an image based question, yeah, so that's what we said. It's a palmar cutaneous branch of median nerve is superficial, but the main median nerve basically is deep, okay, within the flexor retinaculum. So remember that what is superficial? Ulnar, palmar, okay. So this is up, okay, this is up, that is above the flexor retinaculum. So remember the mnemonic for the structure superficial to flexor retinaculum is up. So what is the up standing for? All the ulnar nerve, the ulnar artery, and all the palmar. The palmar cutaneous branch of ulnar and median, and the palmaris longus, the tendon of palmaris longus. So remember the mnemonic for this is up. These structures go up the flexor retinaculum. Okay, so median nerve is beneath, but the cutaneous branch, the palmar cutaneous branch of median nerve is superficial to flexor retinaculum. Is this clear with everyone? So this is very easy to remember. Just remember up, ulnar and palmar. जो भी ulnar है और जो palmar है वो है up, that is superficial. ठीक है? Yes, ये नया mnemonic है. So Naveen, like I said, you are going to learn some new mnemonics also. Okay? Right, going to the next one here. So these are the structures superficial. We have seen some books also mention this, flexor carpi ulnaris का tendon. ठीक है? बाकी ulnar, palmar, ये this is what you see. Going to the next question. Structure passing through the marked opening is which of the following? They are not asking you whether this is IVC, aorta or esophagus. ये image देखे obviously ऐसे नहीं पूछेंगे. Which is the other structure passing through the marked opening out of the given options? Very good. Absolutely right, Surya. Correct. thoracic nahi hai, vagus hai, vagus. Okay, that is vagus. So look at the diaphragmatic openings, very, very important. The first mnemonic is I ate 10 eggs at 12. So I ate is IVC is at T8, eggs esophagus is at T10, AT aorta is at 12, T stands for thoracic duct. So aorta and thoracic duct go together. A also stands for azygous vein. So remember that at 12 is aorta, azygous vein and thoracic duct. X is esophagus. Okay. So look at the opening here. You can see the color also is telling you that this is the IVC blue color. This is the muscular wala esophagus and this is sabse piche osteoaponeurotic aortic opening. So this opening basically is showing the esophagus, and remember that rhyming with esophagus is the vagus. So what goes along with esophagus is the vagus. So remember, this is vagus that goes along with the esophagus. So what is this vagus? Vagus is the 10th cranial nerve. So remember, this is at T10 level. Vagus, the 10th cranial nerve, goes through the T10 opening, that is the esophagus opening. So one is vagus and the other is the vagus ka. Esophagus, vagus ka, also remember gastric. Okay, the left gastric artery ki branches. Left gastric artery or uski esophageal branches. Okay. So what did we learn here? A zygous vein is at 12, that is aortic opening. Thoracic duct is at 12. Right phrenic nerve goes along with the IVC. Okay, right phrenic nerve goes along with the IVC. If I ask you the question that which is that opening which is present in the central tendinous part of the diaphragm? Is it the IVC opening, the esophageal opening or the aortic opening? Very good. You can see that this is the central tendinous part and the IVC opening is present in the central tendon. So remember, it is C and C. It is the caval opening which is present in the central tendon. Okay, so it is the caval opening which is present in the central tendon. Is this clear with everyone? Right? So IVC is present in the central tendon. That is what we should remember. Going to the next one in the top 10 mnemonics. This is your 10th one, the last one. Coming to the venous system development. Which of these is not derived from the vitelline vein? Which of these veins is not derived from the vitelline vein? Left phrenic nerve directly pierces the diaphragm. It does not go through any opening. Very good. The correct answer here is superior vena cava. Superior vena cava. Right? So remember that vitelline vein. What is derived from the vitelline vein? LIV. Whatever is related to the liver is the vitelline vein. Okay. So the portal vein supplying the liver. IVC has a hepatic segment, liver, and of course the hepatic vein. Okay. So remember that whatever is related to the liver, vitelline vein is your liver wala. LIV, vitelline is from LIV wala, liver wala. So liver को supply करने वाला portal vein, drain करने वाला hepatic veins drain into IVC. So all this basically is from the vitelline vein. Okay. Superior vena cava, on the other hand, you could have actually, logically guessed the answer here for everybody who got this wrong, that these veins are related in the abdomen, below the diaphragm. IVC नीचे है, portal vein नीचे है, hepatic vein नीचे है. So vitelline vein somewhere below the diaphragm wala. The only vein which is above the diaphragm is the superior vena cava. So use this cheat code which is odd man out, as I call it. This is like the odd man out wala cheat code. Okay, so SVC ऊपर वाला है, मतलब probably this could be the answer, बाकी सब तो नीचे है और आजू बाजू में है. ठीक है, absolutely right. SVC develops from the cardinal vein, but which cardinal vein? Anterior cardinal vein or the posterior cardinal vein? Superior vena cava develops from anterior cardinal, posterior cardinal. It is the anterior cardinal vein. Okay, that is the anterior cardinal vein. And which anterior cardinal vein basically? Right side, left side? It is the right side. Remember, all the veins in our body predominantly are present on the right side. The superior vena cava, the inferior vena cava, and they drain into the right atrium. So the venous system is basically developing from the right side. Okay, so it is the right anterior cardinal vein and the right common cardinal vein, the anterior cardinal vein, common cardinal vein, that forms the superior vena cava. Okay, when you get a double SVC, it's basically the left-sided anterior cardinal vein persistence that is giving a double SVC. Okay, if the left side persists, that is when it gives rise to the double SVC. We have discussed all this venous system development in the main videos again in the Medsynapse app. Please do watch that video for everybody who's there on the app, and if you have not watched that video, please do watch. I've discussed the IVC development in detail as well. Okay, so that was about the top 10 mnemonics for today. I hope you have enjoyed this session, everyone. Right, and a quick reminder here that this is basically the holy offer still going on the Medsynapse app by Dr. Nikita, where concepts meet mnemonics, right? And both these are very, very important to crack your exam. So we have launched the 4 months plan, like I was saying, at just 2,799. So even if you take the subscription now, whether it's for your upcoming INICET, NEET PG or FMGE exam, it is definitely going to help you, right? So start with the short videos for those who are new on the app or will be new on the app. You have short 5.0, which is approximately 40 hours of videos of 18 subjects. All 18 subjects completed in 40 hours, and it's basically full of tricks and mnemonics to help you remember the volatile, but at the same time the most frequently asked topics. उससे start करो, फिर PYQ KBMD पे जाओ और फिर main videos पे जाओ. ठीक है? Thank you so much. Hope messages like this reinforce the faith in whatever I'm doing. Thank you so much, and they really mean a lot, right? For you it might be just one message, but for me, like, it means the world. Sushant is asking, I score good enough in subject-wise tests, but my score remains between 110 to 120. See, so probably what does that mean, Sushant, is when you get in the grand test the questions which are jumbled from one subject to other, probably then the recall is becoming an issue. Okay, so frequent revision is what is needed, revising again and again whatever you have read. And please make use of all the mnemonics, like I said, that we have discussed. They are definitely going to help you. If you want a rank within 5,000, your score has to be 140, like correct hona hi chahiye, if that is your target. Okay? Right. Thank you so much. Short covers which subjects? HK Supreme. If you have scored 5 on 10, definitely you need to watch short. It covers all 18 subjects, except like the 19 subject radiology, because that is on prep ladder. A quick update, everyone, here we'll be doing radiology LRR tomorrow on prep ladder YouTube channel at 12 noon. So be there for radiology revision as well. That's great. Okay. Yes, Ayush, I'm going to do that. Don't worry. Graph and GT is going low, Monica is saying. See, without analysis, I will not be able to tell you that where actually you should be working upon. If you are making those questions wrong, which are from the topics that you have already read, that is something which is not going to be acceptable now. So rather than, going to new topics, you should be revising the resources that you have already read. And even if after doing that you are not able to recall, please take help of the mnemonics in remembering everything. Vision, like I said, if you are a new user on the Medsynapse app, first start considering that you are giving the NEET PG 24. or the FMG 24. If you are a NEET PG 25 aspirant, then you should be starting with the main videos first and then come to short. If you are a 24 aspiring student, then the short first and then the main videos. Okay. Thank you so much, Surya. There are a few other queries. Let me just see that. Amrit, radiology part will not be available online in the app. Dermatology is complete. You can check the recent videos that I've uploaded in short. Sure, Shri, I'll do that. Live class tomorrow on PrepLadder YouTube channel for radiology. Yes, vision if you are 3 months se baki hai, then first do the short and do the PYQ KBMD. At least do that before your exam. Hematology session needed. Let me do it very soon. Okay, we'll definitely do it soon. 3, I'll do that as well. Okay, Monica, I've already shared the schedule in my last sessions. You can check the last YouTube live sessions. I've already given a schedule and we are having classes based on that as well. Okay, so that was about the today's top 10 mnemonics. We are going to do this for all the subjects, right? If you have enjoyed this session, and when are we meeting next? So remember, the next you have the Fast 5 quiz, which we are going to do tomorrow. That is 1st of April, and this is no April Fool. So we are going to do it at 7 p.m. It's going to be YouTube live session. The quiz has already been uploaded on the app. So very interesting, questions which will compel you on thinking, critical thinking, analysis is what will develop with these Fast 5 quizzes. So give the quiz on the app. It's free for everyone. You'll see on the home page itself of the app. And all the previous Fast 5K annotated PDFs also I've uploaded on the app for everyone in the featured classes section. So the PDF is also available for the previous sessions if you give the previous quizzes also. Okay, so I'll see you tomorrow. Please do appear for the quiz and let me know in the tomorrow session how many right did you get after, when we meet live for the tomorrow's session. Okay? Yeah, hope I'll how to cover the backlogs. You have to find out time in these 15 days itself for whatever backlog is remaining. At least 1 hour, try to squeeze in from somewhere for completing the backlogs. Okay, and make sure that you are concising your material, that when on 16th April our cycle is ending, so you will be focusing on revising only and not wasting your time on consolidating the material. Do that before 16th April. No, Dr. Gamer, it's an extra edge. Basically, it's the core, and at the same time, it is something which is like not enough. The best example I can give you is like, the role of salt in food. Your food will be very tasteless without salt, but at the same time, you cannot just eat salt, right? So it's a very, very essential component, but at the same time, it's not like this is just enough to get you like the top ranks, but definitely it will help you to get that top rank. Okay, so that's the best analogy that I can give you. Okay, so that was about today, guys. I'll see you again tomorrow. Till then, goodbye, take care, keep studying, keep revising, keep medsynapsing, and keep winning. Thank you.